Hi again. This is our second video. And I was just laughing. Dr. Tariq said that he wanted to name this, the whole thing that we're doing as, hey doc, what's going on? Is that right?
Yes. What's going on, or what does the symptom mean?
Yeah. What does
That's the
my symptom?
most that's the most common question we get from our patients. They come with a symptom and they're like, hey, this is my symptom. What does it mean? Why is this symptom, so strange? Why is it so peculiar? So they usually ask, what does this mean?
Yep.
Why do I have a headache with COVID? Why?
Yeah.
You know,
Exactly.
that's what they
So,
ask.
I was just thinking, you've every time. So we've been discussing cases. We have a couple of groups. There's one on Telegram, one on WhatsApp, and I've seen amazing results when doctors actually apply what you teach, and patients getting a relief from the symptoms, be it long COVID, be it COVID, be it as related to vaccination. So I'm just curious, how many patients do you see a day?
So when the COVID wave was on, I used to do hundreds of cases in a day. And then as
Wow.
the Delta wave went down, the number of COVID patients started to decrease. And now with Omicron back in India, it's back to doing hundreds of cases in a day. So the number goes up and down, up and down, up and down constantly.
So
And
how many of these patients end up getting long COVID?
uh,
What's it like?
See, actually, we don't know what the percentage is. There are reports that show 26% of patients after COVID get long COVID. There are some
Okay.
reports that put the number at around 40%. The important thing is that the severity of your COVID doesn't actually determine whether you're going to get long COVID or not. And now with the vaccination on, there are at times cases where you don't know whether this is a vaccination post vaccination issue or is this a post COVID issue. We've
Yeah.
seen many cases having a mixture of both the symptoms, so we're not really sure whether this is long COVID or post vaccination. What we do know, or how we could possibly define long COVID, is symptoms or persistent symptoms of COVID which have carried on for around 12 weeks after you've recovered from COVID. And
Got it.
those symptoms could actually be anything. It's not even connected to your COVID. So, well, during COVID, you didn't have a headache, but now after COVID is gone, you start having a daily headache. Or after
Mm.
COVID is gone, you start having gastritis and you have acidity. That's one of the symptoms that you could have. So it's not just the symptoms of COVID which are continuing, it's just some chronic symptom that's happening which has lasted for 12 weeks after your COVID's gone. I think that's the best way to define what long COVID is, or what the long haulers syndrome is in COVID. You're telling your daughter to go back.
Yeah.
Yeah.
No, my mom-in-law actually.
Okay.
So, uh, if you can, like, what are the broad categories of the different types of symptoms that commonly come to you? And I hear that it's a bit difficult to distinguish sometimes. Is it long COVID? Is it post-vax? Is it just the patient being the patient? Their regular day-to-day symptoms.
Jesus.
That,
Yeah.
yeah. So, but sort of, what's your sense of, like, the big broad categories?
So the most frequent category that I've seen is chronic fatigue. This is one symptom that I've seen in all my long COVID cases. They all have this chronic fatigue. Many of them suffer from anxiety attacks, and those anxiety attacks are usually not emotional anxiety, but it's coming from cardiac anxiety because they suffer from palpitations. So when they get frequent palpitations, you obviously are going to get anxious whenever you feel something's wrong with your heart. So palpitations, chronic fatigue, high blood pressure or blood pressure fluctuations, these are the most common symptoms that I've seen. But then we of course see other symptoms, for example, lack of smell, which is also called as anosmia. That is a symptom which doesn't cause a person debility in the sense that they don't have any pain with it, But it can be quite a problem when you lose your sense of smell and taste because you can't taste your food anymore. So you don't feel like eating anything. And many of these cases who come to me have not don't eat food. They start losing weight because they can't smell or taste. So it is a very severe debilitating disease just because you can't smell. You may not have
So
anything
true.
severe.
It's like a whole huge part of your enjoyment of life. I've heard
Yeah.
it's because the virus goes and affects our cranial nerves. Is that correct?
No, so there has been no published paper that shows it affects your nerves, but it does affect the cells or the supportive structure around your nerves.
I
So
see.
the cells supporting your nervous system are affected by the virus, and we do see that there is inflammation in that area post having COVID. So it's about how to treat that inflammation, which I'm going to explain in this entire series. How to look at your palpitations, how to fix them, how to fix your high blood pressure, how to fix your headaches, how to fix the hair fall that you may have after COVID. And there are so many other symptoms which I'm going to go into the meat of and try to explain things to you.
My husband had a low white blood count. So it's very clear. I mean, it's real to me. Long COVID is a real entity. And then there's so many different advice, like different groups and different communities, doctors advising different things. And the thing that I'm a bit concerned about is there's a lot of use of steroids, as a lot of use of some of the common supplements such as melatonin and vitamin D and vitamin C, and I don't know how much good or harm they might be doing in the long run. And there's like seemingly no end point to it. It's like, well, what are we treating? How are we actually treating it? So the pathways, the mechanisms of action is just not very clear. So I hope you can clear up some of these things as we go along, and we'll try to keep to the, as I say, just the facts, ma'am, right?
Yes, yes. I'm going to try
Right.
to explain what that symptom means. So when you're asking your doctor, hey, what does this symptom mean? Why is it so peculiar for me? That's what I'm going to try to explain, that this is the meaning behind your symptom.
And
So
then
like when you said
the
about your
patients can,
husband's,
oh
yes,
sorry, and then the patients can bring it to their doctors and
yeah,
enlighten your local physician. And
yeah.
if you think that they're open-minded enough, they might even want to come on board and join the group of us to learn so much about this low-dose precision medicine, uh, which is really, I feel, a very gentle and unique, gentle and safe way. Because I was just thinking to myself, why is homeopathy so, in a way, pervasive? It's all around the world. Almost you can get it almost anywhere. It's because if it doesn't help, it doesn't seem to do much harm. Is that true, Dr. Tariq?
Yes, if it's not going to help you, it won't do you any harm. And
Cool.
it's really very, very safe. But here what we are trying to teach you is that you can actually interpret the meaning of your symptom and then take a specific remedy to fix that symptom.
Fantastic.
Sometimes you may not have very clear cut symptomology, so you can actually try the medicine and see if it works. If it doesn't work for you, that means the pathway that we are thinking is wrong, and it's a very, very good diagnostic tool at times. So if I think that this is the particular mechanism that is causing your problem, and I feel that this particular homeopathic may work, I do try it on my patient. If it doesn't work, that means this is not the mechanism which is causing your problem, and within at times a few attempts we are able to get it right. So the one small example is for your own child. When she had an asthmatic attack, you clearly told me that the asthmatic attack started after she ate cold ice cream. And then you also told me that she has allergies in the night, and because of those allergies, she continuously rubs her nose. So the two homeopathics I told you to give her was arsenic album. That's the first one because the asthmatic bout started after exposure to cold, which means it was most likely due to interleukin 4, which arsenic album targets. And the next thing I told you to give a Naxomica because the attacks were happening in the night, which were most likely acetylcholine induced. And then when you did give these two, she got much, much better at a very rapid rate. When the allopathics for asthma weren't working, this is what helped her recover. So
Yep.
it's the meaning behind these symptoms that we're trying to explain.
Yep. Yep. I was really at my wits end, and we were trying a whole host of other ones, and it was like we were still having to use the allopathic drugs. So we really can't employ these in sort of like the same way that we use allopathic medicine. We really have to listen to the symptom of the patient and the story behind the causality of what has come up. So I hear two things here that we will try our best to teach you, but it would if you're not sure, then there's a is there a way that patients can reach out to you, Dr. Tariq,
Yes,
or
there
one of
is.
us?
They
Yeah.
can email me at tariqjagmag@gmail.com, which is TARIQJAGMAG@gmail.com. With any queries, I can share my messaging number with them then on the email, and they can message me their reports. We can, if there is a doctor close to them, we can then forward their messages to the doctor, who can then take up the case. And if they need any
Fantastic.
further help with interpretation of their reports, I could possibly help them interpreting what they need. So we are not just
Fantastic.
looking at their symptomology, and at times we also need few lab reports. Like in your husband's
Yes.
case, when his total white blood cell count was low, it's a homeopathic or a NAT which brings those counts up. So at times we may not be able to understand what the symptom means just from you telling it, but we may also need to get a few lab reports done. So just
Yep.
when I talk about fatigue, I think that's the first symptom that I'd like to talk about fatigue and how we go about treating it. So in the next video, we're going to talk about the fatigue, because there are so many different things that cause fatigue in long COVID patients, and it's really
Yep.
important to go through that entire list to understand what's causing you that fatigue and what is the remedy that you need for your fatigue.
Sounds good. Thank you so much, Dr. Tariq.
Thanks,
That's
Dr.
the end
Dave.
of our second video. Stay tuned for video number 3. And if you like what you
Subscribe below.
see, subscribe below, obviously.
Thank you.